right. Good morning, everybody. Dr. Rafich here from Vet Triage. It is October 8th, 10:57 a.m. Pacific time. We are going through, this issue of JAVMA. This is May 15, 2015. And the article for today, Pathology in Practice. Look at that. And let's get into it. So this is a 7-year-old male neutered boxer dog that had a history of vomiting, melena, and weight loss. The dog had a left thoracic limb amputation, I think 5 months prior, for a osteosarcoma of the radius. So osteosarcoma, well, first let's back up to melena. Melena is dark tarry black stools, and it's an indication that there's a gastrointestinal bleed higher up. Higher up meaning stomach, duodenum, jejunum, and so small intestinal region. Whereas if you had hematochezia, so which is blood in the stool, it's fresh blood that you see in the stool, and that's usually lower down the GI tract. So probably ileocolic junction, colon, rectum. So that's an important differentiation there. And then osteosarcoma is a malignant bone cancer in dogs, which we'll go into here in more detail in a bit. But he had amputation done a few months prior. At the time of that surgery, thoracic radiographs did not show any evidence of metastatic disease. So there was no evidence of osteosarcoma spread to the lungs, which is the most common site of osteosarcoma metastatic disease at the time of the surgery 5 months ago. So currently on physical exam, the dog had a fever, pale mucous membranes. They found on the blood work a leukocytosis. Leukocytosis is elevated white blood cell count. And again, it's always important to characterize what makes up the leukocytosis, which cells are high, the neutrophils, the monocytes, the eosinophils. So you want to say a leukocytosis characterized by neutrophilia, for example, here. And neutrophilia means elevated neutrophils. The dog also had anemia. Now, again, with anemia, you want to describe how severe is it? What's the color pattern like? What's the size of the cells? And is it regenerative or non-regenerative? So here you have a moderate microcytic hypochromic non-regenerative anemia. Microcytic means that the cells are smaller in shape, or smaller in size rather. Hypochromic means they're more pale than they should be. Non-regenerative means that the body either is unable to make new red blood cells, or it hasn't been long enough time, 3 to 5 days, to make new red blood cells. So it looks non-regenerative versus regenerative. They performed a canine fecal PCR, which is polymerase chain reaction. That was negative. They're looking for a bunch of different bacterial and viral organisms. Abdominal ultrasound found a heterogeneous cavitary lobulated eccentric mass involving the jejunum. Heterogeneous means it's got different echogenicity, so different dark and light and gray areas to it. Cavitary means it has within it cavitation, so usually blood-filled cavities within it. That typically indicates necrosis. And it's lobulated, meaning it's got multiple lobes to it. And then it's eccentric, meaning it's not concentric, so it's at the edge of it's more towards the edge of the intestine in this case and not in the center. The surrounding mesentery was heterogeneous with hyperechoic and hypoechoic striations. So that indicates peritonitis, inflammation of the mesentery, and peritoneal effusion was also present. The dog received red blood cell transfusion, some gastroprotectant treatments, then underwent surgery to have the mass removed, which it was. So then and I'll show you what the cytology of the mass is. There you go. So what it says there, let's see. These cells are plump mesenchymal cells. They have prominent and multiple nucleoli. They have anisocytosis, anisokaryosis, and a high nuclear to cytoplasmic ratio. Some of the cells were large and multinucleated. Let's go through that. Plump means the cells are bigger than normal. Mesenchymal implies like spindle-shaped cells coming from a certain embryological origin in the body, as opposed to epithelial, which is the other category of cells. We have prominent and multiple nucleoli. Nucleoli are the tiny organs that are located within the nucleus, and they are involved with replication of the cell. So usually nucleoli, you really can't see them, but these not only can you see them, but they had multiple. Anisocytosis means that there's differences in cell size across the board with these cells. Anisokaryosis means different size nuclei within the cells, and a high nuclear to cytoplasmic ratio means that the size of the nucleus, the nuclear material, was large in comparison to the cytoplasm when you compare it to the total volume of the cell. The reason why these are all important: plump, prominent and multiple nucleoli, anisocytosis, anisokaryosis, and a high nuclear to cytoplasmic ratio. Those are all markers of malignancy. And then multinucleated cells can be either cancer or chronic inflammatory cells, but otherwise it also may be indicative of cancer as well. So of course we're all thinking this is a cancer in this dog, and it came back as a metastatic osteosarcoma of the jejunum, and that was the diagnosis. Now what's cool here, we've mentioned this in previous live streams, this picture up here, you can see how some cells are dark. They used what was called a alkaline phosphatase activity stain. What that does is it looks for, these are again immunohistochemical markers, special stains that we perform on cells to find out if we can figure out what the origin of those cells are. Sometimes it can be difficult to determine what is the origin of a cell on cytology. So you can apply special stains to help light up the cells that are of a certain lineage. And so alkaline phosphatase, which we'll go over here later, is a bone isoenzyme, and osteosarcoma is a bone tumor, and so the cells are showing markers of being of bone origin. Then in this picture down below, notice the lake of extracellular eosinophilic material. So you see all that cloudy purple stuff. So the ones that are not cells, this stuff here, and that tells you that that these cells are producing, in this case, bone, or at least the precursors to bone. So now let's go into the discussion. Osteosarcoma is a tumor that arises from neoplastic osteoblasts. It is the most common primary bone tumor in dogs. Most osteosarcomas are primary skeletal tumors with approximately 75 to 85% originating in the appendicular skeleton. So when they say primary bone tumor, that means it originated in the bone tumor. If you perform a CT or especially an MRI on these dogs, you'll see that the bone tumor actually is coming from the bone marrow, and then it bursts out the cortices. And then an appendicular implies long bones, so limbs, for example, whereas axial skeleton implies the shorter bones, like the ribs or spine, vertebral column, the skull. And let's see. Having primary extraskeletal osteosarcoma is very rare. So extraskeletal meaning outside of the skeletal system. So in this case, jejunum, primary as opposed to metastatic or tertiary. Metastatic, or you could say secondary, I guess, means spread of tumor from somewhere else. Tertiary means the tumor is invading a adjacent structure. So the biological behavior of osteosarcoma is locally aggressive with a high rate of metastasis, albeit usually subclinical early in the disease process. Metastasis to lungs via hematogenous route is a frequent occurrence, and lymphatic extension to regional lymph nodes is rare. So hematogenous, meaning something is traveling from one location to the other through the blood supply. Lymphatic routes implies traveling from one location to the other via the lymphatics. So osteosarcoma, and that's why it usually shows up in the lungs, because it goes through the vasculature if it's going to spread. And so obviously the lungs have blood supply, whereas lymphatics, not so much so. There are no case reports of intestinal metastasis of primary appendicular osteosarcoma in dogs. So this is the first report of it. Alkaline phosphatase is a membrane-bound enzyme that is synthesized by many cells of the body, but primarily by epithelial cells, including hepatic, renal, and placental tissue. So liver, kidneys, and placenta, in addition to bone, produce alkaline phosphatase, and that's why that stain was very useful. Among connective tissues, however, which is mesenchymal, spindle cell that we mentioned, as opposed to epithelial, which is the other category of cells, only bones produce alkaline phosphatase. To differentiate osteosarcoma from other mesenchymal tumors, this stain was used. And the dog did fine after surgery. So this is a pretty straightforward case report. I like it. I didn't realize osteosarcoma of the intestines. I knew it was rare, but I had no idea that this is the first report of jejunal. Maybe other reports or other reports of metastatic osteosarcoma of the intestines in dogs are not jejunal, maybe duodenum or stomach or whatever. But anyway, very cool case, University of Georgia. And that's it for this live stream. It was a quick one. We'll see you guys again tomorrow for another one. Thanks for watching. Bye-bye.